Welcome to Health Break by UPMC Health Plan, your quick guide to health, wellness, and how to make the most of your health insurance plan. I'm your host, Dr. Camille Clark-Smith. This is your Health Break. In this episode, Lindsay Joseph takes a health break to talk about statins. She will discuss what these medications are, how they work, and who can benefit from taking them. Lindsay, thank you for taking a health break with us today.
Thank you so much for having me.
Let's get started. Could you explain what are statins?
So I think when a lot of people hear statins, they think of cholesterol medications. And while that is what statins do, that's not all that they can do. Statins have also been proven to reduce the risk of heart attack and stroke, which are two of the leading causes of death in the United States. There are millions of people in the U.S. that take a statin medication, and they are very well tolerated. They've been proven to be both safe and effective. There are several different statin medications available, and if it's right for you, your doctor will work with you to find the right one. They may take into consideration what your risk for heart disease is, what your current cholesterol levels are, and if you have any history of statin use.
So, how do statins work?
Statins work to lower cholesterol, which is a waxy, fat-like substance found in your blood. And although some of the cholesterol in your blood comes from food, most of it is actually made by your liver. And there are two main types of cholesterol. There's the good cholesterol, referred to as HDL, and there's bad cholesterol, also called LDL. And sometimes when your body has too much of the bad LDL cholesterol, this can lead to a buildup in your arteries called plaques. This restricts the blood flow and can increase your risk of having a heart attack or a stroke. But statins can do a few important things to help prevent this from happening. They help lower that bad LDL cholesterol, they help increase your good HDL cholesterol, and lastly, they help prevent and stabilize plaque buildup on the walls of your arteries, reducing your risk for a heart attack or stroke.
Who can benefit from taking a statin?
Healthcare providers prescribe statins to people for many reasons, and not only because their cholesterol levels are high. Many people can benefit from a statin regardless of what their cholesterol level is, based on their risk for heart disease or stroke. The benefits of using statin medications are really greatest for those that have the highest risk of health problems. This is why the American Diabetes Association and the American Heart Association have recommendations for statins. Make sure you talk to your doctor to see if a statin is right for you.
What are some of the potential side effects of taking statins to look out for?
So, as it is with any medication, some people can experience side effects. Serious side effects from statins are very rare, and people who do have problems generally experience mild ones. They're very well tolerated, but some common side effects that we hear with statin medications include muscle pain, cramps, and weakness. However, these are very common problems that might not be attributed to the statin medication. While the risk of experiencing side effects with statins is low, the risks from not taking a statin can be very high. Completely discontinuing your statin therapy can increase your risk of heart attack and stroke, so it's really best to avoid discontinuing altogether whenever possible. We always suggest that you talk to your provider if you have any symptoms or concerns. Many people who have had side effects to a statin in the past can actually tolerate a lower dose or a different statin altogether. In addition, some statins can be taken less frequently, yet still provide that cholesterol lowering and the cardiovascular benefits.
Thank you so much for that information. Would you like to share any other tips about taking statins with our members?
Definitely. So, as it is with any medication, it's really important that you take your statins and your other medications the way that your provider prescribes them. Taking your medications as prescribed is really critical in managing your condition and improving your overall well-being. Some common tips that we recommend to help you stay on track with your medications include using a pill box. So this is an easy way to keep your medications organized and make sure you don't miss or double up on any doses. Next, we suggest that you fill a 3-month supply on your maintenance medications. This ensures you have enough medication on hand and can cut back on your trips to the pharmacy. We also suggest setting your statin prescription on automatic refills. This allows the pharmacy to refill it when it's time, and they'll even call or text you when it's time to pick them up. And lastly, just make taking your statin part of your daily routine.
Lindsay, thank you for spending some time with us and helping us learn all about statins.
Thanks again for having me.
Talk to your doctor about whether statins are right for you. Check the show notes for more information. Find show notes and more information at upmchealthplan.com/podcast. Join us as we continue exploring health, wellness, and how to make the most of your health insurance plan in the next episode of Health Break. This podcast is for informational and educational purposes. It is not medical care or advice. Individuals in need of medical care should consult their care provider. Views and opinions expressed by the host and guests are solely their own and do not necessarily reflect those of UPMC Health Plan and its employees.